Yeah, this is very tight right in here. When I squeeze in here, I can see the muscle react going right up the neck. I'm pressing in the muscle that goes right along the vertebra in the neck, right in the back here. How does that feel there?
It's sore.
It's sore, yeah. Okay, so this muscle here covers a very big area. It comes like this, and it comes all the way down the back here. So, let me check. Okay. And the right side.
There.
Yeah, right in there.
Yes.
Okay.
There.
Okay. So we need to treat these areas of the upper trapezius muscle here for the tightness and pain that he's been feeling in the neck and upper shoulders.
Hi, we're live with Facebook on Well with Peter Dubitsky, an acupuncturist and the Director of Clinical Training at the Tri-State College of Acupuncture. He's here to show how acupuncture can be used to treat chronic pain and to demonstrate how acupuncture works.
All right, so we've just completed an assessment of the patient's neck, shoulders, and upper back, and I'm ready to begin the treatment. And so the first thing that I'm going to do is to treat a couple of points, acupuncture points that are down near his ankles. Then I'm going to come back up to the upper body and treat the areas around the back of the neck, upper shoulders. So to prepare the points for treatment, I've got a cotton ball that has alcohol soaked in it. So we're going to do these points here, here, and here. So those are prepared, and now we're going to get up here to the neck. Okay. Now I'm doing a specific style of acupuncture that is called acupuncture physical medicine. And within this style of acupuncture, we use a certain technique called trigger point acupuncture. And that's why I was assessing the musculature to find where are the tight areas that would either be causing the pain locally or causing pain to refer and restricting range of motion. So it's a unique style of acupuncture that we teach here at the college. Okay, so let's start with this point that's right in here in the lower leg. So the needle is in the plastic tube. The tube is pressing against the skin, and then I tap the needle in, take the tube off, and then the needle gets set to the correct depth. Is that okay?
Yes, sir.
Okay, and then I'm going to do a different point on this part of the leg. Just going to find the spot, and I do that by pressing in and finding the anatomical landmark. Oh, you felt that one, right? A little bit? Yeah. Okay, so we're going to do the same points on this side.
So Peter, if I can interrupt while
Yes.
you're doing this, Tracy is asking Tracy is looking into acupuncture for migraines, and she's wondering if acupuncture can be useful for treating migraines.
Oh, absolutely. I've treated many types of headaches, including migraines, very successfully with acupuncture. So she should definitely look into it.
And would treatment for migraines be similar?
Actually, in a lot of migraines, there's tension in the musculature of the back of the neck and upper shoulders. And an assessment for a migraine treatment might look a lot like this. There'd be more. I'd want to see how the front of the neck is. There would be some questions about lifestyle and diet. So there's more to it than just checking the back of the neck and needling here. But this would be part of the treatment for migraines. So this patient is an athlete and a martial artist and uses his body a lot. And sometimes these muscles just get a bit overworked. So, okay, so we're going to start right in here. Okay, and I'm going to do a similar point on this side. It'll be easier for you to see if I stand around here.
And we have another question about arthritis. Can acupuncture be used for arthritis?
Acupuncture can be used for arthritis to help to treat the pain associated with the arthritis, but it's not going to change the arthritic condition of the joint or area where the arthritis is. But there have been well-documented studies that have shown that acupuncture is very effective to treat, say, osteoarthritis of the knees. And you notice that I'm manipulating the needle a bit. There. Is that okay, Houston?
That's good.
It's good.
Why would you manipulate the needle? What does that do?
That's telling the body that the needle is here. And I'm also looking to see how the muscle responds to the needling. And by doing this, I'm looking to get a twitch response from the muscle. And this technique of manipulating the needle at a certain depth within a certain part of the muscle may do that. So as I'm going in with the needle, I'm assessing the muscle. How is it responding to the stimulation of the needle? And so I'm not getting that twitch response that I expected I might get, which tells me that the muscle itself has good tone, that it's not too tight. Oh, when I did this one on this side, I got that twitch response that went from here all the way up the back of his neck. So, oh, there it goes again. You can see his head moving from this. Is that okay, Houston? Okay. So I'm getting quite a few of those twitch responses from that muscle, which means that I know the result will be that this muscle will loosen up and he'll feel so much better afterward.
And we have a question from Luca about how long will the needle stay in the skin?
Well, generally they stay in about 10 minutes.
So would you put, in a treatment, would you put them all in at once and remove them at the end?
Well, it depends on if I need to do other techniques to the needles. If I need to do some electric stim, then I'm going to leave them in and attach the device to the needles to create electric stimulation there. I could just remove the needles altogether right after I get the twitch response, but it's generally better to leave them in for about 10 minutes after you get done. So I'm going to go just to another spot right here. Oh, getting a little twitch response there. You can see how the muscle is moving a bit. Okay.
So we have a few skeptics in our commenters,
That's
and
okay.
they're wondering what the scientific evidence is that acupuncture works.
Well, the whole discussion of how do you prove scientifically that acupuncture works, you can't really do double-blind studies with acupuncture, but there are lots of clinical case studies. You see how the muscle's responding there? and this is the lower end of the same muscle. It comes up like this. So I know clinically from experience, from 25 years of experience, that what I'm doing here is going to have an absolutely positive outcome. He's definitely going to feel better. That may not satisfy somebody's scientific inquiry, but I know it's so. So, I'm going to do the lower border of the muscle on this side as well. So here, there's no twitch response. So we saw plenty of twitch response on the right side. Nothing here, and there was nothing here. So there's tightness here, but there's hypertonicity. There's much more tightness here. So tightness verging on spasm there.
So now that you know that, would you focus more on the part there was more tightness?
So I'm going to now come back to the left side and see how this is here. Does it continue to feel okay to the needling? So I'm assessing again after the needles are in. I just need a couple of movements of the needle to see. Okay, good. And I feel one more spot here. So we'll get that one.
The lower trap just twitched.
I saw that. On the left side that wouldn't twitch before. There it goes. Okay, you could feel that one twitching, right? Yeah.
A question from Carolyn Brown. Do professional athletes use acupuncture to recover from injuries?
Occasionally they do. I can't name any athletes without their permission, but I know of some very famous athletes that do use acupuncture to deal with problems and to promote optimal performance, both athletes and performing artists.
Mm-hmm.
All right, so I'm going to move on to doing some electric stimulation on the needles.
Okay. Can you explain a little bit about the electric stimulation, when you would use it?
Yeah, so if somebody is very sensitive to needling, they may not like the technique that I was just doing. But I know that the outcome is that I want the muscle to relax, and in order to get that to happen, if I can't do it with mechanical stimulation, I can get the needles in so that you don't feel any discomfort, and then I can connect the needles to the electric stimulator to get the desired result. So since this was very reactive, and I don't want to really traumatize the muscle with continued manual technique, I'll add the electric stim to this area to continue to stimulate this side that was so reactive.
What does the patient feel with the electricity?
Okay, so first I'll get the wires hooked up in place. They connect right to the shaft of the needle, and the needle becomes, in a sense, an extension of the wire, sending very mild current into the muscle. And so what I'll tell somebody is that in this area where we've just connected the wires, you're going to feel a tapping sensation. And that's what it is. It's rhythmic tapping as the current is coming out. Okay, we've got that set to 2 cycles, 2 hertz. And I'm turning it up slowly now. Let me know when you feel the tapping.
Feel it?
Okay. Is it mild, medium,
Mild.
strong? Mild. Comfortable?
Yeah, you could go a little bit higher.
Does it feel like a finger tapping on you?
Yeah, just it is as if there's just something tapping right there in the spot. That's good.
And you can see the needle moving. The reason the needle is rhythmically moving is because the current is causing the muscle to contract rhythmically. So when I was doing it with manual technique, the muscle was twitching, which is a contraction of the muscle. And now electrically, we're facilitating that continued contract, relax response from the muscle. And there's a whole series of physiological changes that happen from the stimulation with the electricity.
So Fernando is asking how the acupuncture you're demonstrating compares to traditional acupuncture techniques?
Mm-hmm.
What's the difference? What's the similarities?
Okay, so in all acupuncture, there are what we call ashu points, points that are areas of tension, or when I press them, they're sensitive. And in traditional Chinese medicine, as a style of acupuncture, you would find those ashu or ouch points. And that's what I'm looking for, but I'm looking for them as trigger points in the muscles. And if I find what are active trigger points, meaning that they're responding and twitching as I needle into the area of the muscle where I know the trigger points that tend to be located, then I know, okay, this is a trigger point pain condition. And if I do this technique with the needles into the muscle, it's going to result in the muscle relaxing, the pain going away, range of motion improving.
We have a few questions in about if acupuncture can help mental health issues like depression.
It can. There's a local effect from the needles. We see that there's a definite response in the area where the needle is placed, but then there's also a systemic response to acupuncture. So anytime we put needles in the body, the brain is going to react, the whole nervous system reacts, and there are biochemical changes that go from the initial kind of fight or flight response to the body being pierced by needles to a much more relaxed state. And in that relaxed state, people feel calm, they feel better. There are chemical changes that occur in terms of hormones that facilitate a more relaxed sense of well-being. And so that might help somebody emotionally, although it's not treating the underlying emotional behavioral issues.
So how long would you let the electricity go through?
We need maybe 5 minutes. You know, in terms of doing this as a demonstration, we don't need to focus on this for 5 minutes, but just, yeah, so about 5 minutes, and that should be sufficient. So we could say at this point, 5 minutes is up. You can turn the machine off. That serves as a good demonstration, and it will give him a definitely good treatment.
So Tammy is asking, is this good for temporary pain treatment, or can it get to the root of a problem and fix a pain issue?
Well, it all depends on what the root of the problem is. And if it's soft tissue, which is meaning all muscular, 1 to 3 treatments should give a definite positive response. And 1 treatment might be enough. It might take a couple of treatments. If there's an underlying structural problem in the body, then it becomes pain management and may not be treating the underlying structural problem. So if there was a herniated disc in the neck, it's not going to unherniate the disc. There's still going to be that tendency for the problem, but it's a way of managing the pain and the condition without drugs. No side effects to acupuncture.
Is there any risks? Anybody who shouldn't try acupuncture?
Well, there are certain risks. They say that during the first 3 months of pregnancy, to avoid certain points, certain kinds of stimulation on the body, just to maintain the pregnancy. But other than that, as long as an acupuncturist is properly trained, licensed to perform acupuncture, they know what the contraindications are for the individual patients they would be seeing, and it would be perfectly safe. If the acupuncturist felt that they had some concerns, they would express that to the patient.
And for somebody who's looking to try acupuncture, how should they go about finding a practitioner? What questions should they ask to make sure they're trained properly?
Mm-hmm. Well, you'd want to make sure that they're licensed. Whatever state you're in, they're licensed by the state, and all states have different requirements for licensure. There's a national board that certifies acupuncturists, and that board exam is the basis for licensing in most states. So anybody that's board certified and licensed has done all the schooling, and they're qualified to do acupuncture. And then within that, there are different styles of acupuncture. So this style is something that's unique to what the college teaches here, although we also teach our students traditional Chinese medicine as a style of acupuncture and a certain kind of Japanese acupuncture called Kiko Matsumoto acupuncture. So students like Houston on the table here is going to have very unique education in terms of what's available in America, because he will have learned 3 styles of acupuncture, which would make him very well suited to be able to provide care for the patients that he sees.
And are the different styles better for different conditions?
Well, every style is going to cause that general systemic effect, whether it's just done in the ears or done on the body, or it's traditional Chinese medicine, or it's APM or Japanese or whatever. And but that's a very good question, and there really hasn't been any kind of study on that. So it's really hard to say definitively is one style better than another for a particular kind of condition. But I would say from my own clinical experience that trigger point acupuncture is almost essential for treating myofascial pain conditions.
And we have a question from Luca about, he's seen acupuncture done with longer needles.
Uh-huh.
Is that just something he's seen? Is it different than what you're demonstrating?
Well, I don't need to go very deep into the body, so I don't need a long needle. These needles are a little over an inch long, and I'm able, it's the way I'm holding the muscle, squeezing it, setting it up for needling so that I can use a fairly short needle. The rest of the needle would be hanging outside the body, so it wouldn't really serve a purpose. If we had to go into the butt, where the muscle might be deeper, I would need a longer needle to reach the muscle. But these are all superficial muscles and easy to access with a 1-inch needle. So now I'm going to take the needles out. And just looking, make sure there's no bleeding there. So you see the skin is all red from, these are the areas where I've pressed, squeezed, and treated. And that's just circulation coming to the skin there. And the skin will all normalize after a little while. There's one spot where there's a spot of blood from a needle, and this happens. There's a small capillary under the skin. You can never see where that is. So I compress it with, yep, and that's that. Simple. All right.
So if an acupuncturist suggests you come for 2 or 3 treatments, how would they be spaced apart?
It depends on the nature of the condition. So if it's a pain condition, we probably want to see somebody twice during the first week and then once to follow up, and they may not even need to come back the 3rd time. But that would be all set up so they'd have those 3 treatments scheduled and ready to go. Okay, so needles are all out. And the last thing I do to finish this off is use an external liniment. This is something that's called white flower strain relief oil. And it's nice because the needling is a little traumatic to the area, and there could be some soreness resulting just from the treatment. And that's something that the patients are always aware of because it's part of the discussion before we begin treatment. So this is a topical analgesic. So for a pain condition, this is very nice to put on. And I'm going to put a glove on, otherwise I'm wearing this stuff all day long. All right. So I'm going to just rub this into the skin, get it absorbed. So this is a bit of a massage, but it's to facilitate circulation through the area that was just treated, get the liniment absorbed. Okay.
Great, thank you for demonstrating that. One question a few people have had is the cost. Is acupuncture ever covered by insurance? What is a price range for treatment? Does it
Well,
depend?
price range pretty much is determined by where you are. My practice is in Rhinebeck, New York, and upstate we have a lower cost of living, lower cost of rent, so treatments cost less than in New York City. And you probably say that there's a range of $80 to $200. And it all depends on the acupuncturist and where they're located. And insurance coverage is possible. I myself, I'm a provider for Blue Cross Blue Shield, and I can bill Aetna, Empire State, New York Government Employees Plan, a variety of other plans. And so insurance reimbursement is possible. It all depends on the plan, what the benefits are.
Thank you. Is there anything else you want to add about acupuncture?
Well, we could go on and talk for an hour or two, but no, I think that covers it very well.
All right. Thank you so much.
You're welcome.